After the subway sections opened in 1978, suicide and suicide attempts became known on the subway in Vienna, Austria's capital. Still, in the 1980s, when the subway had only been around for a few years, people rarely killed themselves or tried to kill themselves there. But there was a sharp rise in 1984. In 1984, print media noticed that people were killing themselves. They wrote a lot about it, with big headlines and pictures of the people who had died by suicide. People at the station during the incident were interested in reading about the suicide after it happened. Because there was a lot of press coverage and then subsequent rise, guidelines for reporting on suicides were issued to the press in the middle of 1987 by the Austrian government. This experiment was to see if it could stop people from killing themselves. The experiment aimed to lower the suicide rate and the number of suicides and suicide attempts on the Vienna subway. Regular training and direct contact with journalists and editors had to be conducted. Suicides at the subway were then covered less sensationally. The number of suicides and suicide attempts in the subway dropped by more than 80% in just 6 months after the media rules went into effect. Suicides dropped right away in places where the media worked together a lot. The Austrian media got better at telling the whole story about suicide, even though the number of suicide stories reported didn't change. Since 1987, almost twice as many people in Vienna used the subway, and the number of suicides has decreased by 40% in Vienna and 33% in Austria. These facts support the idea that Austrian media guidelines have positively affected suicidal behavior. The past teaches us that meaningful change can occur surprisingly fast. Training journalists to report on suicide responsibly is indeed effective. Please give these questions some thought before moving on. What have been India's biggest problems with suicide coverage, especially in the last few years? Why does the media cover some suicides more than others? Individuals rarely discuss suicide or their struggles with mental health, but they search about it. An internet search thus becomes the significant intervention point. After the 2020 celebrity suicide in India, Greg Armstrong, an Austrian researcher, and Dr. Lakshmi Vijay Kumar, a renowned psychiatrist and suicide prevention expert from India, did a study on Google search trends and found that there was a big spike in the number of people searching for how to suicide, how to die by suicide, and help for suicide. The Press Council of India, PCI, has framed guidelines on how media should report on suicide, which is in line with the 2017 update of the World Health Organization report on preventing suicide, a resource for media professionals. These evidence-based recommendations give the Indian media a framework for responsibly reporting suicide or mental illness while reducing harmful content for vulnerable audiences. When writing about suicide, it's important to be careful to inform, not sensationalize, educate, not speculate. Your headline or story should not include any excessively dramatic information. Instead, present information about the death that is factual and sensitive to the needs of the bereaved family. If a suicide death is written about in a way that sounds alarming or dramatic, it may get too much attention. Don't put suicide in headline or put it at the top of a story about suicide. Don't use dramatic headlines and don't talk about the same stories too much again and again. If suicide is widely reported and given a lot of attention, people may identify themselves with the person who has died. It is often the case, especially when a celebrity dies by suicide, which raises the risk of copycat behavior. Do not romanticize or glamorize suicide. Instead, give background information and facts to remove the suggestion that the suicide was caused by heroism, honor, or loyalty to a person or group. Using the wrong words can make people think that suicide is common and it can't be stopped. Don't say anything about the site or location. If you want to say, keep the location details as general as possible. Be careful and considerate when using pictures or videos to tell a story about someone's death. Before considering whether to publish photographs or videos, consider what the images or videos reflect in the context of the individual's death. Suicidal thoughts can be made worse by details and graphic images. It might be a good idea to ask the family of a person who has died if they want a certain photo to be made public. To stop people from copying a suicide method, don't give too much information about it. To decide if the details are too much, consider whether the events you describe need to be explained. Think about whether the information could lead someone to end their own life. Listed below are some examples of details that may be too much. In a hanging death, the ligature is the point from which the body hangs. How many pills were taken in an overdose? Don't speculate about the deceased person's personal life. Instead, try to be as general as possible when talking about the person. Sharing personal information about a person who has died could make some people feel too close to that person. So be very careful when choosing which facts to include and be ready to explain your choices. When writing about a novel suicide method, be careful not to draw attention to it and make it more likely that other people will try it. When a novel method is used to end life, one counts on the media to spread the word about the dangers. We don't want vulnerable viewers who don't know about the method to learn about it and increase the risk of they dying by the same method. Be careful about telling people what's in a suicide note. Say that a note was found, but don't say anything else. The information can be taken out of context, leading some people to identify themselves too much with the person who died and their reasons for killing themselves. Carefully choose what you say. Journalism is a gray area regarding how language is used in the news. Suicide is not a typical way to deal with problems or mental illness. The words should not make it sound like suicide is a way to escape from situations that make it hard to deal with life. So don't make suicide seem like a way to deal with problems. Instead, say that most suicidal people can improve with help, support, and treatment. It is important not always to mention depression when discussing suicide. It can make people think that mental illness always ends in suicide, which is a gross exaggeration. The mood of the general public can be improved by using respectful language that honors the life of the dead, instead of picking apart every detail of their death. Don't use alarming terms like epidemics, skyrocketing to quantify suicides. Instead, use the most up-to-date information and simple words like increase or raise to describe it. Don't report a suicide the same way you would report a crime. Section 115 of the Indian Mental Health Care Act 2017 says that anyone who tries to kill themselves will be thought to be under a lot of stress. Thus, the Indian Penal Code of 1860, Section 309, which makes it an offense to try to kill oneself, would not apply. So avoid saying committed suicide. It makes suicide look like a crime, which makes people who have lost a loved one to suicide feel bad about themselves and keeps suicidal people from getting further help. Use died by suicide instead. Avoid using words like successful or failed when discussing a suicide attempt. Unexplainable or without warning are not good ways to describe suicide. When someone dies, their death affects the community and people who know them. So, report on suicide as a matter of public health, not a single case. Please be aware that it's hard to talk about how to deal with grief after a suicide. It can be hard to talk about or explain when someone you care about has died. Also, people who have lost someone close to them to suicide are more likely to do it by themselves. Include the warning signs of suicide and, if possible, a what to do sidebar, as well as links to places where people can get help. Include ways to stop thinking about suicide and improve coping skills. Increase the amount of content that shows how common mental health problems are and how people get help and do get better. When a story is about suicide, it may be upsetting or triggering to the reader. The main message should be to encourage people to get help when they need it. It might be helpful for editors to point people who read these articles to places where they can get help. So do include numbers for helplines or other resources in case of an emergency. Trigger warnings should be used before anything about the event is said or shown. When an article is about suicide, it can be hard to write a narrative that the audience will understand and respond to. This is done without making it more likely that the reader will identify too much with the person who died, which could lead to more deaths through contagion. Reporting on the method can be a greater challenge and risk for some of your audience members who will look up the method and try to copy it. So, if you can help, try not to include the method in your news item. If you must discuss the method, do it as briefly as possible. The contagion effect or copycat effect will be smaller if the article doesn't give specific details about the suicide. It gives more ways to get help in a similar situation. It talks about a crisis that was solved and that didn't lead to suicide. And it gives background information on suicidal behavior and suicide in general, such as what to do with someone who expresses suicidal thoughts. An individual's suicide is a tragic loss. Every tragic death has a face and a family. So journalists must choose their words carefully to tell the stories they find in a sensitive and a humane way. Words matter. Ask what the story is really about. Does it need these details? Or are they trying to make it more appealing, more glossy? Is there anything else I need to pay attention to? Demonstrate empathy rather than sympathy. Don't guess why people kill themselves. Don't judge people who have died by suicide. Instead, think about why they didn't have access to mental health care. With power comes responsibility, and reporting responsibility is indeed a challenge. Show the human side of the crisis and stories of success, like how some lethal pesticides have, when they have been restricted, it can lead to reduction in suicide. It is important to stop talking about suicide as a single factor choice made by a person who may have a mental illness and start talking about it as a complex multi-factor problem in which social determinants play a major role. Look at how people are being led down by the systems, infrastructure, financial institutions, and failure of basic organizations. The power of person's story is very strong. Real life stories show that alternatives and how people have learned to deal with them. The faculty of Department of Mental Health Education, Department of Psychology and Department of Psychiatric Social Work, NIMHANS, and I have published a study in the Indian Journal of Public Health. The study analyzed the quality of newspaper coverage of suicides in Bengaluru, South India, from January to December 2017 in 3 popular English newspapers. The complaints of 395 suicide reports with media professionals, 2017 WHO recommendations for responsible suicide reporting were analyzed. Only a few sampled articles adhered to the essential recommendations. Reducing sensationalism, giving help-seeking information, and educating the public on suicide prevention without perpetuating myths are the 3 essential areas that demand the most attention in the Indian media coverage of suicide, as reported by the study. How to safely cover suicide clusters? A suicide cluster is defined as a group of suicides or suicide attempts or both that occur closer together in time and space than would normally be expected in a given community. Tamil Nadu is said to have one of the highest rates of student suicide in India. According to a report from National Crime Records Bureau, NCRB, in 2020, about 46 people died by suicide every day in the state, and more than 2 of them were students. In July 2022, the death of a student in class 12 at a private school in Kalakuruchi, Tamil Nadu, got much attention in the media. So what happened? Many news outlets speculated and sensationalized the suicide death to make the case more interesting. Reports about the location, method, and details of the suicide note were all over the media. The ensuing violence and the minister's visit to the deceased home dominated the headlines for several days. The suicide of Kalakuruchi was the first prominent occurrence in what has become a cluster of similar deaths, the cluster of suicides. Over a few weeks, several suicides in the same age bracket occurred at various Tamil Nadu locations. The judicial system was forced to intervene, asking print and electronic media to be more responsible when reporting, especially the news about children. It highlighted that media should stop making suicides into big stories and repeatedly showing them again and again to the public. The print and the electronic media shouldn't keep showing the photographs. They shouldn't dwell too much into information about the method, and it shouldn't have screaming headlines, which were all there in the Kalakuruchi death. They have to give phone numbers for help. The victims' names shouldn't be made public, and their privacy should be respected. Clusters of suicides should be reported, and public bodies should be held accountable for taking steps to stop them. But writing about clusters of suicides can draw too much attention to the number of deaths, which could make the deaths more disturbing and lead others to do the same. Journalists should look at how they show cluster reporting to stop others from doing the same. It might be best to avoid words or presentations that emphasize the number or frequency of deaths, as this could promote the cluster in a way that wasn't initially intended. Notify the media outreach team if there is a chance of cluster of suicides happening in a certain place. Ask them to stop talking about people who died by suicide in great detail and linking the deaths together. There is, of course, the chance that bringing the reporters' attention to a problem they didn't know about before could get them a lot of attention. How about murder-suicide? Murder-suicide, also called homicide, is different from suicide. In these cases, as with suicide, the circumstances are usually complicated. Focus on facts and comments that show that the incidences are rare instead of speculating about it. It will help calm the community down. Be careful when writing about survivors of murder suicide. Research shows that many people who commit homicides have mental health or drug problems, but most are not violent. It is inappropriate to glorify, vilify, or simplify the deeds of individuals who commit murder suicides. Those who commit murder suicide should also not be held in high regard. Don't talk about the details of the crime, like how to kill someone or how they got the weapons. It's important not to say that murder, suicides, and other violent crimes happen too often. When there is an evidence that the person who did the act has a mental illness, and if the person's condition needs to be made public, do so in a way that doesn't stigmatize the condition. It is important to put murder suicides in the right context to figure out what drove them. It is important to let people know how to get help for mental health problems. Example, helplines. Avoid extensive coverage of murder suicides. Let's conclude this session by addressing how India's media must support the fight against suicide. The first step is to think about who is covering suicides and how. The one thing that editors all over India can do to make the biggest change is to have health reporters cover suicide. When a health editor or health reporter covers suicide as a part of a health beat, as opposed to a crime reporter covering a crime beat, the tone and tenor of the coverage are greatly impacted. These people have access to the medical field and are more likely to understand a person's medical or health problem. Increase the number of articles about preventing suicide. Give resources for preventing suicide and use safe and inclusive language. Remember to leave out information like the weapon used, the gory details, and interviews with deceased family who may not be aware of preventive messages. Be careful about linking a certain event to suicide. When it comes to suicide, no one thing can be blamed. So do not say that a single thing or a set of things caused the death unless you can prove it otherwise. Separate facts from speculation. Speculating about suicide only helps to spread myths and false ideas about it. Instead, talk about the warning signs and risk factors that give a general idea of what happened before the suicide. There is far too much jargon in the narrative of mental health professional or mental health expert-led publications discussing the causes of suicide. So include articles written by people who work in suicide prevention or discuss it as special contributors. Have a wider range of people from different backgrounds to quote. Sometimes it seems like the press has to fight to keep its freedom of speech. A well-known public figure often dies by suicide or something disturbing like a suicide pact or a suicide cluster or an unusual new method is noted. When something like this happens, the news tends to cover it quickly and widely as soon as it happens, often sensationally on the front page because there is a lot of pressure to cover the story quickly. In the days and weeks that follow, there is a lot of discussion in the media about possible reasons, which is purely speculation. In cases when media is made aware of the potential harm their reporting may do, they generally work together and make changes to their coverage. The head of the press team can call a private media briefing to remind the team to report responsibly and give them specific instructions for the situation. For accurate, consistent reporting on suicide, everyone in the newsroom needs to be able to weigh in on how the story is told. If you see unsafe content in the print edition of the media, you can talk to team members directly to ask that the online postings be changed or even maybe removed. Getting rid of explicit, potentially harmful content online can make it less likely that the coverage will lead to copycats. Learn to treat your words respectfully, whether talking, tweeting, or texting. Moderate online comments on the media. Remove any inappropriate reader comments. Media influence on suicidal behavior and action is emphasized in national suicide prevention guidelines and publications. All known national plans for preventing suicide include standards for how the news should be reported on suicide related content. By following media reporting guidelines, the press can ensure that the information it gives to the public about suicide is safe without putting press freedom at stake. It will always make people in the media act more responsibly, making suicide news stories that follow more considerate and helpful.